Hello and good morning. Welcome to FiDi ChiroCast with Dr. Sean Cotter. Today we have a special guest, Dr. Yusupov. How are you, doctor?
Doing great. How are you guys?
I'm doing great. Thank you for asking. Welcome.
Thank you.
Um,
Happy to be here.
awesome. How's New York treating you, doctors?
The weather's great now. It's nice and cool. It's not humid. There's no rain anymore. It's perfect, actually. It's great for outdoor sports and just, living life without like worrying about rain and stuff and humidity.
That's,
Yeah, it's been really nice lately. It's 80 in the 80s and
Yeah.
no humidity, low humidity. It's been beautiful. The beaches are great, and just walking around, it's very comfortable. Unlike
wow.
Miami, where you are.
That sounds like not, it doesn't sound like you're describing New York, but it sounds great.
True. Yeah.
That's good. How's everything, Dr. Cotter? Did you see the
Everything is
Olympics?
great. Was that? Did I
Where'd
watch
you,
the
where'd you,
Olympics?
yes.
Yes, I did. A little bit. Yeah, a little bit. I watched the basketball. I like the swimming. Um, we did well. It seemed like we did pretty well. And I think I love the 100-meter dash.
Oh, yeah.
It's a great event, and I was very happy to watch Simone uh, Biles. Is it
Biles, yeah.
Biles? Yeah.
Pronounce her
Simone
name.
Biles.
Yeah, I love the fact that she's been so dominant for so many years, and she came back this time around and won a few gold medals. It was really impressive at her.
And she had an
her age.
injury, I believe. She had an injury.
Yeah, I mean these athletes, they have to overcome these injuries, and I'm sure she has a chiropractor in the background helping her out.
That's for sure. That's why I remember I was watching the Olympics. I was like, hey, Dr. Cutter probably has seen some athletes go in his office and it goes hand by hand, all right? We spoke about it all the time about athletes and chiropractic and how important it is to
Oh,
understand this in
absolutely.
your body.
Yeah, for them to sustain the kind of schedule that they have and what they put their bodies through, they have to have support. And chiropractic is a really really good supportive tool for them to keep performance high at a high level. And yeah, we've treated a lot of athletes and even people that are not known. They're just they're in triathlons and marathons and the CrossFit workouts and stuff. They come in and they
Yeah.
they want to recover quickly, especially if they injure themselves, and so we can help them, get past their injuries and continue to compete.
Absolutely. So today we are going to be speaking about upper back. We've touched, the lower back a lot, and I feel like upper back is also, very important. I myself, had some questions in regards to upper back, but it's mainly, feeling your shoulder blades glued together. How does
Hmm.
that feel? I wanted to ask you both. What can cause his patients to feel their shoulder blades glued together, and restrictive breathing, because you mentioned that breathing is very important and goes hand by hand with the chiropractic thing.
Yeah, I mean, I wouldn't refer to it as glued together, but that's one way of describing it. But your scapula are independent of the thoracic cavity. They're connected by muscles and ligaments and things, but they're not your typical type of bone to bone connection. So they're attached to the shoulder, which is a very complicated joint. And what happens in a lot of people is that as a result of poor posture, shoulders forward, sitting at a computer for many hours a day, or just poor posture in general, from reading, from sitting, and just not being aware of your shoulders, in the proper position they should be, and they should be in a set back position. So we treat this all day long, every day, and it's not just the upper back. What I would refer to it as the thoracic spine, which has 12 vertebrae, T1 through T12. That encompasses a large area, and it's all
Okay.
protected by ribs. So the ribs are integral part of the thoracic cavity. There's not a lot of movement in the thoracic cavity because the ribs are a closed chain that connect anteriorly at the sternum. And it's very important to understand that the musculoskeletal system of the thoracic spine is a very tight system, and you can feel restricted because the ribs articulate with the spine and can cause a lot of tightness and that feeling of restriction. So what we do as chiropractors is we look for those regions that are restricted and we free them up to increase the range of motion and also to reduce pain and relax the muscles. So there are muscles between the ribs that are called intercostal muscles, and those muscles at every level have a nerve, artery, and vein that are running parallel to the muscle and within the muscle. And so if those nerves get twitchy, then the muscles get tight and it restricts your breathing in a very physical manner, right? I mean, your organs,
Okay.
like your diaphragm, is the muscle of the lungs to help, expand your lungs. But if the outside skeleton is restricted, it's not going to be able to get a full expansion of the lungs. So
Exactly.
what we do as chiropractors, and the way we can help people that have breathing issues or feel like they can't take a full breath, is we adjust the ribs and the spine, and it frees all of that up and increases the skeletal range of motion to allow full expansion of the lungs.
So
Does that
the
make sense?
Yeah, it does make sense. And I was gonna ask you, obviously the bad posture, right? I mean, if you're doing 8 to 12 to 10 hours sitting down, maybe with the same posture, you're gonna feel more tight. But what are the ways to prevent maybe the shoulder blades in your body to be tight and restricting breathing in this case?
So I'm going to let the young chiropractor talk about that. He's more fit than I am. In terms of exercising, it's very important to exercise the scapular muscles. You should do more back exercises than you should do front exercise, and I'll let him elaborate on that.
Right. You definitely want to have a balanced approach to your upper back, upper body exercises, right? So when you're as much as you are pressing, as you should do as much work for your back as well. And a lot of
Exactly.
times people associate that with doing like shoulder shrugs, just because it's working that visible trap muscle that everyone wants
Yeah.
to have, and that the V-neck. But the thing is, if you really overwork that and get that too strong and too tight, the lower rhomboids and the mid trapezius, lower trapezius, those muscles are neglected and kind of underworked and underutilized. And a lot of times, then people have that kind of that shoulders forward posture, which we see all the time in private practice every day.
Let me sit up straight while I'm at it.
Right, exactly. So we want to have a lot of mid back and upper back work done, but not in the shrugging, like all that shrugging stuff. That's great if you don't have any issues up here, but you want to really focus on like low rows, mid rows, face pulls, which we could definitely all demonstrate today and show you guys. So we take like both an active and manual approach on patients on a day-to-day basis, meaning like we could do manual scapular mobilizations with our hands, obviously thoracic manipulation, and that's like the manual part of the treatment, and muscle work in the region of the thoracic spine and the ribs. And then also we have the active approach, which is like some of the exercises we'll demonstrate for you guys today. So
Please.
as
Yeah.
yeah. So two approaches, active and passive, basically, and a lot of patients respond very well to that. And unfortunately, a lot of times chiropractors don't have time to do the active part and only do the manual, and that's where the block is within the chiropractic care world, like where the visit is too fast, adjustment in and out, and the patient doesn't learn the exercises.
That's not how we work, though.
That's
We
not how we
we
work.
actually
Yep.
when the patient is in our office, we give them exercises to do so that
Yep.
they're participating in the active aspect of their care. Because if they're not doing that, then what we're doing is just like expensive aspirin. We want to make them feel better, and they can come to rely on us for making them feel better. But they can take an active role in getting their
Exactly.
muscles stronger, so that they hold the adjustment better, and they're able to maintain their health and their posture, so they don't experience as many exacerbations or crises in their care. But I'd like Solomon and to start to demonstrate a couple of exercises that are just basic things for the.
Okay.
Why don't you talk about some of those things? So we'll stand up and
Yeah, no problem.
we'll
So
turn this
one thing I would actually say is when a person is, let's say, at a desk all day, it's taking like frequent breaks every hour or so. Stand up, walk around, go to the bathroom, come back, and then while you're on that break of from sitting to standing, you could do a couple of these like thoracic rotations, which I'll show you right now. Essentially, you could do it bent over or on a table. So if you just want to, yeah, there we go. You want to show me right here? I'll do it right.
Yeah, sure. I'll adjust this a little bit. What would you
So-
want to do?
Basically, you have to just get on all fours and just like this. And you want to just rotate your mid back as best as you can, just like all the way through here, and then come up like this.
And what do you call that?
Thread the needle. So basically, you would take your right arm, for example, here, all the way through, and then come up all the way like that. And then as you're doing this, you're taking an inhale and exhale very slowly and thoughtfully, just like that. all the way through.
So we're getting rotation of the trunk there and the shoulder and the scapula as well. What else do you perform? What do you
Then when you switch sides, just take it nice and easy, and you want to really go all the way through with the rotation, and then come up all the way through, just like that. And as you're doing that, you're inhaling and exhaling as well, just nice and slow. So you could do that like on all fours like this, but I understand, some people don't have access to get on the floor in the middle of a workday. So you can also do it bent over at a desk and just literally just go like this and just do the same exercise bent over and knock it out with that. So that's one movement right there. That's like a very easy, anybody could do it. You don't have to have any special equipment. And so it's very easy for patients to do it and actually take home and do it.
That's called thread the needle.
Right.
Now laying your side facing me, and I'll do some scapular mobilization. So a lot of our work is, as he said, manual, which is passive. We're doing the work ourselves, so it's passive on the part of the patient. Okay, so put this arm behind your back, this hand on your shoulder, bend your knees. And what I'm going to do is I'm going to reach underneath the scapula here, the scapular bone. And there are muscles around that bone, all right? The subscapularis is underneath there. That's one of the rotator cuff muscles. Then you have the infraspinatus, the teres minor, and the supraspinatus, okay? So what we're doing, we're focusing here more on the subscapularis, and you're just sort of rotating this, and you can actually lift the patient up. This guy is kind of thick up here. I can pick him up a little bit, but I'm really trying to just separate the scapula from the underlying muscles, which are called it's glued. That glued effect, that feeling of like you're stuck. So that gives you a lot of relief. And it helps break up some adhesions in there that are underneath the scapula. And you do that on both sides. What else do you want to do?
Then there's a couple exercises we could do with a TheraBand. So, Dr. Cotter, you want to have a seat right here? I'll show you. I'll demonstrate it on you.
Facing this way?
Yeah, you can face that way. And you want to put your left leg up on the table. And we'll do something called a low row. And so I'll demonstrate basically how the scapula is supposed to move in this. Since we're talking a lot about scapula here. Just like this, leg out, or a bit, and so like that. All right, so nice and upright posture, and you want to start with your arms straight forward, like elbows locked forward,
Right.
just like that. And then what you're going to do is from here, you're going to go all the way back in and tuck your elbows in together, squeeze your shoulder blades together,
Right.
down and back, and now bring them forward. So that's called scapular retraction. And you also want to protract a little bit, just a tiny bit, and then back. So that's a full range, and then you want to go all the way back and retract again. And then all the way forward and protract slightly, just so you have that full range of motion in your scapula.
Yeah.
So that you can actually learn how to move your scapula in its full range.
All right.
Regarding scapular retraction and protraction.
And the focus here is, again, working those scapular muscles, right? Squeezing the scapula together. And we use the analogy of like trying to squeeze an almond.
Like a pencil or a
pencil.
Yeah.
Yeah, just to give them a visual to squeeze the scapular muscle together, because that's where the scapular movement is really what we're looking for, to strengthen those muscles in between. Right. What else do you have?
We could do the same position. I have another one. Yeah. So the next one will be a face pull. So that's going to exactly how it sounds. You're gonna pull the band to your face, but this time instead of going down and back, you want to pull up and around just like that.
Right.
And you want to pull all the way out like that. So we're working the rotator cuff muscles, as Dr. Cotter mentioned a few minutes ago, and bring it forward, like all the way forward. There we go. And then now back in. There we go. So before we worked up down here in the mid back shoulder blade region, now we worked above the shoulder blade region, working the supraspinatus, a little bit of the upper trapezius as well. I know that a lot of times people find it tight, but as what's unknown in the community, in the physical therapy chiropractic community, a tight muscle is often a weak muscle. So when you feel that tightness up here, it's usually weak as well. So you want to strengthen it.
Right.
Right. But not too much, and you want to have it overly balanced upper back and mid back. So that's so we have right there just something a patient could take home. This costs less than $1, I think, honestly, like just one band. Anybody, for the most part, can afford it, get it for themselves, and do a couple exercises a day. And before you know it, in addition to chiropractic care, in a few visits, they'll feel much better.
We often,
Definitely.
when we treat patients, we also will just cut a piece of bandage.
And just give it to them. There you go.
They bring it home and they do the exercises at home, so they don't have to, because we try to remove all barriers for them to do the exercise, because they'll never order, 90% of the time, they'll never order the band. So we just cut off a piece and give them a few exercises to do some homework at home.
Right.
And they improve. It improves quickly.
Dr. Cotter, did you want to
Definitely.
talk about diaphragmatic breathing as well?
Sure, go for it.
Okay. So there's a lot of times people breathe through their chest. So I was going to demonstrate on Dr. Cotter on how to breathe properly. Since we're talking about breathing, I just wanted to touch on it real quick. A lot of times people breathe with their chest and kind of expand their chest area just like that, and then it causes that tension up here in the traps and everything. And what we do a lot of times at the end of a visit, just to, especially if a person is having an acute episode of pain up there in the upper back, we kind of teach them how to breathe through their diaphragm. The diaphragm is made up of all these muscles around the spine and the mid back region down over there. So you want to go this whole area. You want to kind of expand it and bring it in. So you want to bring your belly into your spine and then bring your belly back out, and like a pregnant belly. There you go. And now
I have plenty of belly.
there you go. Now, unfortunately, what we see on a day-to-day basis is people breathing with this right here, and kind of expanding their chest and all this and the mid back, upper back, all that gets super tight, and they feel often, like you guys mentioned, that scapula glued together.
Exactly.
That's it's a multifactorial issue. It's not just one thing. So this is another thing: is teaching a person how to breathe properly, which is
Exactly.
diaphragmatic breathing. We just do a few rounds of this, 10 to 15 repetitions, to teach them how to breathe through their stomach and lower back
And
versus their chest.
you want to keep your belly soft when you do this, and we stress to the patient not to use their chest for breathing. So we want to say, okay, lift your belly out, because as you expand your belly, the diaphragm is lowering, and that's really the proper way to breathe. So when you lower your diaphragm, it actually stimulates the autonomic nervous system. So that's the other aspect I wanted to talk about with the autonomic nervous system. The autonomic nervous system is the part of the nervous system that is, sorry about that, is responsible for setting the tone of the small blood vessels in the organs. So when, you've heard of fight or flight, is when you have a sudden burst of adrenaline, and your heart rate increases, and your breathing increases, and your pupils dilate. So you're in fight or flight mode. That's sympathetic. There's sympathetic and parasympathetic in the autonomic nervous system, and there's supposed to be an equilibrium in that system. So it's been shown that the adjustments of the thoracic spine in particular, which is very heavily involved in the autonomic nervous system, helps set the tone and equilibrium for the balance between parasympathetic and sympathetic. Parasympathetic would be more for digestion, sleep, rest, healing. That's when those systems are really in play. And so when your adrenaline is down and your cortisol levels are low or lowered, that's when your parasympathetic system is dominant. And so the adjustment of the thoracic spine actually stimulates the autonomic nervous system. And so it helps your breathing, not only from the musculoskeletal system, which I described before, where you're removing restrictions in the spine and the ribs and relaxing the tone of the intercostal muscles, but you're also stimulating the parasympathetic system to allow breathing, to increase digestion, and it's a very powerful part of the adjustment that people underestimate and are not aware of, I would say.
I mean, as important as breathing is, right? I mean, it's breathing. Just knowing how to breathe makes a huge difference and a huge toll on your body if you're not doing it correctly, right? Yeah.
Right, and so that belly breathing actually stimulates the system, also the autonomic nervous system, and it allows for the stress level to come down. So when you're stressed and nervous and anxious, like before, you come onto a podcast or something, you just do a little belly breathing, and it calms you down. Anything?
Definitely.
You touched on everything there regarding the adjustment. That's great. Yeah.
Yes. Thank you for the demonstrations. The demonstrations were awesome. I feel like it's better for our audience to see it hands-on, because a lot of these can be done at home, right? And that's part of
very easy to do at home. Yeah.
Definitely. And that's after the chiropractic care, then they can go home and practice these to maintain their adjustment and help themselves. So that was very good.
There's another couple of exercises that I want to show you that are very easy to do at your desk, at your home. If you're working remotely, you can do this all day. You stand up and you put this loop. It's another band, but it's just a loop. And this is a great warm up. And what you do is, I'm a little close to the camera, but I'll stand back and you retract your shoulders. And as Dr. Solomon touched on before, when you're doing certain exercises, you want to protract your shoulders, meaning bring them forward and get that full range. But if you have shoulder issues, you want to keep your shoulders in a safe position, in a retracted position, and do rows and things like that, or do these types of exercises, which is a great warm up and a great strengthening exercise. Now, you can also do this clock, they call them clock exercise. So you do 3 o'clock with one arm at a time, 1 o'clock, 5 o'clock, 9 o'clock, 11 o'clock, 7 o'clock. This is really, I've been going through shoulder rehab because I had surgery on the rotator cuff recently. And I have to tell you, my shoulders feel great. They feel better than they felt in a very long time. And that seems to happen after you have an injury and you really focus on the exercises to strengthen those particular muscles, because you're working on the muscles. They're not the big deltoid muscles and the massive, the traps and things like that. You're working on those finer muscles to get proper biomechanics. And
Exactly.
these little bands, they have different tensions. You could start with a very light one and then progress. And as you progress, you do different types of exercises, and they really activate muscles that are often not in play, because our systems, our bigger muscles they dominate over the smaller muscles. And so if you focus on the smaller muscles, it really improves your function.
Exactly. It needs to be all throughout, right? The whole back needs to be being worked on, right? In general, you're supposed to be touching all the other muscles just so it doesn't cause certain restraint. I was thinking about what Dr. Yusupov was saying about the traps, because I mean, yes, you see that a lot, right? People kind of tighten up in this position, and it leaves the other muscles being more weakened, right?
Yeah, well, the traps have 3 parts, right? There's the upper traps, the middle traps, and the lower traps. And so, the I's, the Y's, the T's, and the I's. So if your upper traps are dominant, and you can expand on, then you want to do those middle trap exercises and the lower trap exercises to balance the upper traps, because you don't want the dominance to be in the upper traps. Otherwise, you're going to be walking around like this. And we have a lot of patients like that. They're hard to work on, and they always feel that tension and stress in their shoulders. So
it's all about balance.
Yeah, it's about balancing out, like having enough strength in the upper, middle, and lower. And just like as I said before, like you just mentioned right now, a lot of people just work on the upper trapezius versus the middle or lower. And the middle and lower traps are worked on with like some of those little exercises I showed you, and the ones that Dr. Cotter just showed you right now. They work on the smaller rotator cuff muscles, but they also kind of activate the middle and lower trapezius as well. And people, like we said, neglect that, because like the upper trap is the most aesthetic one, and we see that through the shirts, and people want to have that look. But a lot of times that translates into more like some neck pain and upper back pain, mid back pain, and that's what we see on a day-to-day basis in private practice.
So what differentiates our practice from a lot of chiropractic practices is we actually emphasize corrective exercises. We try to find the cause. We evaluate people's motions and their movements, and we look to see where they're not moving properly, and we try to correct those. And they're hard to describe with words, but when you see certain aberrant or abnormal motions, it clues us into, well, we got to work on these muscles, or we got to work on this region. And getting back to the diaphragm, which is very important. An important concept is the core muscles, right? Everybody thinks about their abdominals, right? Their lower abdominals, their upper abdominals, but also the diaphragm is the top of the core, and the pelvic floor is the bottom of the core. So think about it more like a cylinder that has a top and a bottom, okay? And if you're looking at me from the side, your diaphragm tends to be in this position, right? Because your ribs go from back to forward, they go up. What we want to do is we want to close that wedge from the upper diaphragm, from the diaphragm to the pelvic floor, to be parallel to one another. And that's why we tell people tuck your pelvis, but also engage your upper core to bring the diaphragm down so that they're more parallel. They're never going to be perfectly parallel. They may be like this, but you don't want them to be like that, right? So that way you have balance between the front and the back and the sides, right? So your abdominals are not going to, if your abdominals are weak, then your low back muscles are going to be very tight, and you're going to be pulled into a hyperlordosis, which is an increased curve in the lumbar spine. And that's not great for your back, and you're going to be prone to injuries. There's a high correlation between a weak core and low back pain.
Yes, I have a cool story about that because I came in and I remember Dr. Cotter when you did my adjustment, that was the issue, right? I needed to pour more work into my abs because I was a little bit tilted. I felt like I was kind of pulling my back out, and my lower back was just hurting all the time. So I started doing those exercises at home with with my legs, actually similar to what you guys were doing with the expandable, but with the legs, and it helped out a lot. I felt like I moved. I even got taller. I feel like it feels like your posture just stand better.
Yeah, well, we often talk about creating space. That's what we like to do as chiropractors. We want to expand the spine, lengthen the spine, create more space between the joints, because that compression is what's causing the pain, right? In your joints, you have these pain receptors and nociceptors, they're called. You have proprioceptors. You have all different types of nerves embedded in the joints of the spine, in the facets. And so when you decompress them, you are taking pressure off those, and the pain will stop firing. The pain nerves are going to fire less. But definitely balancing the core muscles, and we all have to work at it. You're not alone. We all have to work at it every day,
Definitely.
and try to minimize, try to strengthen those areas to minimize pain.
Definitely, and be constant. Thank you very much for the demonstrations for the audience. Thank you, Dr. Yusupov, for coming on the show. It's a pleasure. Dr. Cotter, thank you very much for your time.
You're welcome. Thank you, Orlando.
Thank you.
I appreciate it. It's good to see you again.
Same here. Thank you, our audience. Don't remember to subscribe to our channel. And this was it for today. Thank you very much. Until next time.
Take care.
Take
Till
care,
next
guys.
time. Bye now.